Okay. Hello, everyone. I'm very sorry for the delay. Thank you for joining us. Welcome to this webinar. Just a few introductions before we begin today. Zubaan is a feminist publishing house and NGO that chronicles and participates in the women's movement in India. I'm Siddesh, and I will be moderating the discussion today. This is the fifth and last in our series of conversations on the issues posed by the COVID-19 pandemic lockdown in India, featuring feminist activists, researchers, and writers. Today, we will be addressing the theme of the impact of the COVID-19 pandemic and lockdown in India on people living with disabilities. We will be speaking with Nidhi Goyal, Shampa Sengupta, and Bhaotina Mushahary. We are also joined by Saini and Manisha Sharma from Association of Sign Language Interpreters. They will be providing interpretation, so please switch to the gallery view on Zoom if you need to access it. We frame this set of conversations as one about a crisis of care, rooted in the feminist principles of collectiveness, compassion, and care that should be driving responses, ours as well as the state's, to the public health emergency and the parallel humanitarian crisis it has led to. I would like to now introduce our speakers for today in the order of their speaking. Each speaker will present for 10 minutes, following which we will take questions for them. Nidhi Goyal is the founder and executive director of Rising Flame, a Mumbai-based non-profit working for the rights of persons with disabilities, with a focus on women and youth with disabilities. She's been appointed to the UN Women Executive Directors Civil Society Advisory Group. She sits on the advisory board of Voice, a grant-making project of the Dutch Ministry. She is the board president of the Global Nonprofit Association for Women's Rights in Development. In India, Nidhi has been invited to be a member of the core group on persons with disabilities and elderly persons by the National Human Rights Commission and sits on the Diversity and Inclusion Task Force of FICCI. Shampa Sengupta is an activist working on gender and disability issues. She is the founder of the advocacy group Sruti Disability Rights Centre, a non-funded advocacy group in Kolkata that works on disability and gender rights. She is associated with the Women's Studies Centre in Jadavpur University and Calcutta University, and is a life member of the Indian Association of Women's Studies. Presently, her focus is on policy-level changes for women with disabilities, and she has been working on making Indian laws and policies on women pertinent to the lives of women with disabilities. Bhaotina Mushahary is a women's rights activist based out of Assam. She is the co-founder and managing trustee of the Action for Inclusion and Empowerment Trust, a voluntary non-profit NGO based in Kokrajhar, which was set up to work towards the inclusion and empowerment of women living with disabilities. I would like to just go over the rules for the participants who are attending today. Number one, your audio will be automatically turned off on entry with the video turned off as well. Please do keep them turned off for the recording. Audience questions will be taken via the chat box, which we will close once we get a certain number of questions that can be answered today. However, the raise hand function will still be available to direct any queries at the hosts, me along with other hosts with Zubaan in their names. We will start dealing with the audience questions around 12:40 once all three speakers are finished. The discussion will be recorded and posted online via our social media channels. The list of participants will not be available. If you choose to ask a question via the chat box or speak, your name might be displayed during the webinar. So please be aware. Entry will be moderated to guard against trolling. No racist, Islamophobic, queerphobic, or any hate speech will be tolerated. Any participants using such speech will be removed from the webinar without warning. Regarding posting, quoting any of the speakers here today on social media, you are free to do so with the permission from the speakers. I would now like to hand over to Nidhi, who will be speaking for 10 minutes, following which Shampa will speak for 10 minutes, then Bhaotina for the 10 minutes. Nidhi, over to you.
Thank you so much, Siddesh, for the introductions and for setting the ground rules. Hello, everyone, and a very good afternoon, and I hope everyone's doing okay in these difficult times. Since I'm going first, I will try and set a little more context and take a couple of points because there's a lot to talk about disability, the whole angle of care, the whole angle of survival, and the current situation with COVID-19, with healthcare woven in very strongly. I would like to start with just this question of survival. And I was watching a video a couple of weeks ago, and it was of an American doctor. And it really speaks of a global situation, not just in America, but soon in India, or already happening in many parts of the country. The doctor said, we had 40 patients, we had one ventilator. And so we started choosing who it's okay to let go. Above 80, it's okay. You have any kind of illnesses, it's okay. And there the question arises, what happens to people with disabilities? People with disabilities who are already considered at the lowest rung of society in general are not considered as equal, productive, and important citizens of the country, etc. The questions of survival, access, accessibility become even more stronger once we move past the understanding of when you contract COVID, what is going to happen. The question comes, how do you survive in the current situation? How do you even access the information that's around there? If you noticed, many of the addresses by the heads of states, by the prime minister, did not have sign language on the site. Very important announcements, very important information dissemination. If you look at accessible information that was created, most of the content has been done by DPOs, disabled people's organizations, by NGOs, etc., who have been coming out constantly with information around if you're deaf, how do you deal with the pandemic? If you're blind, how do you deal with the pandemic? When you have a psychosocial disability, what do you do? Access to information has always been a question and a barrier for people with disabilities to participate fully in sort of social, legal, and other spaces in a country. And it continues in the current pandemic as well. In a crisis situation, it becomes even more crucial to have an access to information. But what does access mean in general in this current times, right? When we say, okay, we'll all social distance, we will not meet each other, we will not go close to each other, we will not touch surfaces. What does it mean for an individual who lives with blindness? It means that half your input is gone. It means that your independence, the mode of contact that brings you independence, is no longer available. And I remember talking to one of our senior activists who he's blind, his wife is blind, and they live with two elderly parents who are 70 plus. And the father has to still go out, being in a vulnerable population, to get groceries, to buy the essentials, because being a blind individual, having no kind of public assistance, and having left with no tactile options, it becomes very difficult to even navigate and go to the corner store. Just for a minute, think about the deafblind individuals whose all forms of communication comes by touch, by tactile sign language, and the kind of claustrophobia this kind of situation brings. We're talking about people, the mental health situations in this country exaggerating, and I'm very afraid that, again, people with disabilities and the mental health and the trauma that they face because of this whole sort of crisis will again go unnoticed. It's very interesting because I was talking to some other individuals who are wheelchair users who'd also come for some of the sessions that we'd organized, and they said, oh, it's all okay, because we've been in a lockdown state for many, many years. Post my accident, I've left the house maybe once a year with someone's assistance. Some people have said, oh, we're used to not accessing half the spaces in cities and towns anyway, because things are not accessible. So we're not glad that everyone's facing a lockdown, but maybe this lockdown helps people build empathy on what barriers to access bring. Um, it has also been a huge sense of trauma for many individuals, but for those who work, who are on, who live with many spectrum disorders, developmental and intellectual disabilities, a structure, a kind of calendar, a kind of routine works. And again, when there's a disruption of all of that, the support needed is much higher, which is not something that's being spoken about. Something very, again, important to think about is the kind of re-trauma that people with disabilities face because of the conversations in the disability rights movement and the non-disabled movement is around independence of people with disabilities, that you should become independent, you should come at par with others, you should try and do everything that non-disabled people are doing. Because of these kinds of pressures, people have fought hard with social, infrastructural, and familial barriers to come out and become independent, and the lockdown sort of pushes them back into their post accident spaces, in the spaces when they were not so independent, when they were really locked down because of their disability. Thinking about mental health will become important for all of us, but thinking about specific nuances within mental health and the trauma that this lockdown or this crisis has brought will become even more important. For all of this, we as an organization at Rising Flame launched Vela Panti, which was a Saturday series across 4 Saturdays in the month of April, where we continued building empathy, because for us it was important that people with disabilities and others would continue having some conversations, particularly those who were privileged enough to be at home, to be safe, who were privileged enough to have digital access, like all of us are on this call. We're here because we have the privilege of speaking English, privilege of staying connected with an internet, privilege of just affording all of this. And we thought we should continue conversations so that the sense of isolation, further isolation, which people with disabilities may face, goes down. We did get a lot of pushback and trolling around because we called it an online party. Vela Panti, an online house party for people with disabilities to uplift the mood, to give it a sense of positivity. But we really continued conversations around consent, around body image, around shaming, around relationships, around diverse identities. And again, somebody wrote to us saying, but Zoom is not secure. You're basically selling people's data on darknet if you host these parties on Zoom. And they suggested a platform which we could use instead. And my prompt reply was that, yes, we want to be secure, but often people with disabilities have to make these choices between accessibility and security. And this is not a new thing which has come because of the crisis. It makes us reflect on what our realities have always been. When WhatsApp wasn't encrypted, or even going forward, people are like, don't share sensitive data on WhatsApp, use maybe Wire instead, use other platforms. And then we have to turn around and say, but digital security and digital accessibility are not conversations we are having together. And we don't know why, because people with disabilities are continuously being denied digital access and the right to even occupy digital spaces, very much mimicking the physical access barriers that happen. It is now even more than before that you realize that payment gateways, when they are not accessible, everyone's saying, oh, you can order online. When that's not accessible, what does it even mean when you live with a disability? Coming to burden of care, because of all of this, because of you cannot be tactile, or digital spaces may not be accessible, you may need assistance in daily living tasks. You know, when you have access to many more people, not just paid carers, but many more people like friends, like colleagues, the burden of care somehow gets divided amongst society, amongst people you interact with. When I walk on the street and I seek help with from 4 other individuals, the burden of assisting me does not always fall on my family, because I'm independent, but not, which means not dependent on one person. I just walk out and about and seek assistance. Now, in this situation where we're in a lockdown, the burden of care falls entirely on families, and within families, we know, we have researches that say that the nature of care is very gendered. Because of the increase in the burden of care, or the sense and the feeling of care, and the rise in frustrations of families with the impending economic crisis around the corner, with the impending worry around whether survival will be possible. Domestic
Nidhi, we
violence.
have 2 minutes left.
Yes. Thank you so much, Satish. Domestic violence cases are increasing. And we again see the invisibility of women with disabilities here. Because always, when we came around Me Too conversations, we said Me Too for all women, but we never looked around and said, but why don't we have cases of women with disabilities? Now, from the UN to the NCW, everybody is talking about domestic violence. And I don't see the mention of women with disabilities other than by some select groups of women with disabilities. We're going to come to a new normal, which everyone's been talking about, saying, oh, we are going to come to a new normal, a new normal. A new normal will emerge. My problem is that a new normal does not emerge. We should take this as an opportunity to craft a new normal. And if we don't take this pause as a time of reflection, as a time to say, okay, what was everything wrong that we did around access, around inclusion of disabled people or women with disabilities, it's going to be a new normal, which will replicate or maybe exacerbatedly replicate the barriers and the marginalizations women with disabilities face. We will see that employment cuts will experience, that vulnerable population would mean that vulnerable populations lose jobs more or face higher cuts of pay, even keeping in mind that the cost of living with a disability is higher. We're slowly going back to survival of the fittest, which means that we are back to the Darwinian theory and we reverse many decades of disability rights work where we say it's okay, it's not survival of the fittest, empathy does not work on this basis. We will go back a couple of decades to say there is a hierarchy of needs. Let's talk about food first. Let's talk about shelter first. Let's not talk about violence. Let's not talk about sexual and reproductive health and rights. Let's not talk about access to abortion. Let's not talk about access in general to digital and physical spaces. I think being intentional, being conscious, and taking this time while dealing with our own frustrations and trauma, taking this time to build empathy and expand our ambit to include marginalized voices, not just persons with disabilities and women with disabilities, but other folks standing at the multiple axes of marginalizations would help us craft a new normal and a better new normal. With this, I'd like to end my submissions. I'm open for questions later. Thank you.
Thank you, Nidhi. Shampa, if you could turn on your video, you're next.
Thank you, Siddesh. Am I audible?
Yes, you are.
Okay. Thanks, Nidhi. Being the first speaker, she actually set up the context of the discussions that most of us are having within the disability sector right now. But she's given a broad framework. I'll talk a little bit more on the ground level experiences we are having in India right now regarding disability and caregiving. And I'm talking on behalf of NPRD, National Platform for Rights of Disabled. I'm the Joint Secretary of this network, and we have members across many states of India. Only yesterday we had a office bearers meeting, and it's very frightening because all across India we are getting same kind of information. Only our friends from Kerala could give some examples of state taking some responsibility, but in most of the states we don't have states taking responsibility, particularly for this pandemic, and majority of us are actually whatever service disabled people are getting are through NGOs or DPUs or individual help, which is actually frightening. I'll just come back to this point later, but what I want to express now is from the beginning, we kept on hearing this COVID-19, this pandemic is a great equalizer. It's actually equal for everyone because it can affect the illness can affect anyone can be affected by COVID-19, the virus, but the effect of this pandemic in the amongst the actually it made a large divide, and a divide is very visible. You can see that the rural people are getting different kinds of treatment, the urban getting different treatment, uh, the poor, the rich, even the middle class people, everyone is divided into boxes right now. So you can access this, you cannot access this. It doesn't make a difference whether you are affected by COVID or not, because of the lockdown that has been imposed upon us with very little notice. It's actually affected people in general in a very different tone. And we need to understand the issue of, it's not only the ability and the gender issue, we also need to understand the class issue here, how it affects everyone. Well, some people are saying that they are not being able to access school education because or college education because they cannot access uh, online classes. A majority of the people whom we work are saying that we do not have access to food right now. So now, instead of being a rights-based group, which we actually fight for rights, but generally we have actually gone back to relief right now. Most of the DPOs, we actually had to go back to a relief work. For example, in Bengal, we had to actually buy rice from Food Corporation of India. So, and then the Food Corporation of India will tell us that you have to buy this much. So it's a large amount of money. You have to invest in that. Only then you'll be getting this rice. But we don't have any options. We have to buy that food and rice and give it to our members. Otherwise, they will just die of hunger without any food. And we don't need any virus to kill them. It's very important to understand that disability is a cross-cutting issue in different kinds of phases. Because at this point of time, we are talking a lot about migrant laborers. And many of us who are joining this meeting have been very disturbed seeing migrant laborers working in the street, trying to get back to their homes, when some of us are actually sitting in our home and only trying to get daily food kind of situation. They do not have access to their home. They cannot reach home. But we don't know how many of this migrant labor actually have a disabled member in their family, because we never think of it in that way. When we are saying that the sex workers of their total income is stopped because of the pandemic, because of the lockdown situation, we don't know how many sex workers are having some disability themselves or their children. I mean, I personally know many sex workers who told me that their children are disabled because of the situation they live in. So these are the kinds of things that situation which makes us wonder how disability is a cross-cutting issue, and how even within our sector we also never really thought in this process, because disability cannot be something which is it's not one community only. It's a large number of people are affected by it. And I'm giving you one or two examples here because I have some experience. I remember when I went to Delhi for some work a few years ago, and I had two disabled friends with me. So we took an auto, and the auto driver asked me, because they don't usually, people do not ask the disabled person, even if he's an adult, so asked me, why are you here for their treatment? So I said, no, we are here to for a participation in a meeting. And so he said, no, I think everyone comes to Delhi for treatment of disabled people, because that's why I came to Delhi. I have two children, and after their birth, when the villagers found that both my children are disabled, they told me to leave the village because it's a bad omen to have disabled people, and there might be other people might get affected. And I thought that if I come to Delhi, I'll find some treatment for my children. So these kind of stories we have been hearing throughout our journey, and now we find that now obviously this auto driver will be out of job now because of the lockdown situation. So how are they finding the situation? I mean, we don't know. We don't have access to that kind of information at the ground level, because in a country like India, we also do not have the right, we don't do not have the right number of how many disabled people are there. The kind of census that has been done is a very we do not have a very good experience with a census. We do not have, there should have been a list of people anyway, where in a country which actually talks about Aadhaar and different kinds of, they try to get different kinds of mode to get all kinds of information about us. But there is no list of people, like for each municipality, okay, there are this many disabled people, they might need some kind of requirement right now. This kind of things are not there in place in a government system. And if you do not have that kind of system, then it's not possible to reach out, because DPOs or NGOs, as anyway, we have small entities, we are not government, we cannot reach out to so many people at any point of time. One other point that I would like to mention here is disability pension. We use the word pension. It's actually a kind of a money which is given for people who are unemployed and who
2
do not
minutes
have
left,
any
Shampa.
access. Sorry, 2 minutes? Okay, yeah. And disability pension is something that is only in Kerala, and I think in some parts of Tamil Nadu, we have been told that it's given, it's sent to their home to the disabled people. And large number of disabled people are actually dependent on this pension. And at this moment, they cannot go to the bank because of the transport are not there. So they are not getting that money also. I just wanted to end with one anecdotal, it's not a story, it's a case. On the first day when the lockdown was uh, announced, I received a WhatsApp message which was forwarded from me from Delhi, which from a mental hospital. A father who took his mentally ill son to a hospital to get admitted, uh, because he said he stays in the footpath. He's a homeless person, and he thought, at least if I give my son in a hospital, if I get this admission done, at least he will get some food, because there will be no food right now for homeless population also. And the same day, I actually received an email from which was endorsed by UN and a large number of disability rights groups, which said the mental hospital should be, actually, there should be very few patients there, so that they shouldn't be in touch with each other and things like that. So this is something which I really wanted to talk about, how theory and practice actually do not mismatch. We know ideally there should be less number of people in hospitals, in homes, in orphanages, but these people do not have anywhere to go, and they go there so that at least they can get some food, because families are not able to provide that food right now. And the state, the government is not taking any responsibility. Thank you.
Thank you, Shampa. I will now request Bhaotina to turn on her video and she'll speak for 10 minutes.
Thank you, Siddesh, and uh, thank you, Zubaan, for giving this opportunity. I think what the speaker has very clearly, well defined, and they have spoken about how the people with disability has impacted. So, and I think in everywhere in a globe, in a world, like everyone is suffering for this pandemic. So I would just like to point out, as I am also as a field worker, like as in a ground level worker, and I am also involved now with some relief work in our area in Kokrajhar. So what the people are facing because of this COVID-19 and the lockdown, how the issues people are facing right now. So I would just like to share the experience of our area. So as I think what the speaker has mentioned about how the uh, information is not accessible in everywhere about, for the person with disability. So even same here in I think in our Kokrajhar area, like one of the particular district, I think. So in the main point where I would like to point out is, I think now because of the food scarcity here, uh, when PM Modi have all about announced about the getting rations, like every uh, individual had to get ration of 5 kilos. But what happening here in our area, they're not getting the accurate amount, like accurate quantity. Not they're instead of getting like 5 kilos, they're getting 3 kilos. Some of they're getting only 4 kilos. So that is the ground level uh, crisis happening here in Kokrajhar, and and it is worse for the person with disability, that they are, even if not a crisis before, they are excluded. They are uh, uh, excluded from all the services, from the social, from the education, from the health sector. They are excluded. So here we got to see that those who have a ration card uh, get the ration, they're not getting. Instead, they have a name, but they are not supplying. They're not giving the ration to the person with disability. So this is what I can see in a ground level exclusion. And then recently, uh, I came to across one family uh, where in a family, like two uh, person is terribly in a terribly condition, like uh, two of the senior members of the family. One is a mother and one is a daughter. So mother is a diabetic patient, and she was bedridden, and then her hand and both the hands and legs are swollen up. She cannot even walk. She cannot even eat anything. She cannot pick up anything. So and a daughter is totally paralyzed. She is a bedridden, and two son as one is a student who is studying uh, in a graduate. She is he is sorry, he is studying. He's a student, and another one, he was a daily wager. So now because of the lockdown, he cannot go for a work. He cannot bring any ration for the home. So, and that area is very backward. No one is a service holder there. People are reaching out them, uh, trying to help out, but it's the same. Everyone is now in the same condition. So what happened when we reach out to those family? So there, what happened? We see that woman is trying to uh, have a food, but there is no one to feed her. So at that point, when we reach and we realize that how the social distancing also, like neighboring, they cannot come because they are also maintaining social distances, and they are told to maintain the distance. So because of that, they cannot come and help the family, and to son who are very helpless, they cannot bring her to a health center also, because of the transportation is totally shut down there, and it's really far from civil hospital to their area. They have to travel 21 kilometers from their area to come down to get the medical help. Uh, and the next day, we got to hear that a woman is no more because of the medical help which she cannot afford, and she cannot come with the medical help. So this is one kind of one case where we get to see in the uh, ground level. And when we talk about health, I think now in everywhere situation is same, that they are not looking for a general patient to they are not taking any general patient in the hospital. So this is what crisis. And And there is another family who, a woman with disability. She she was a she was a archery player before, and now she is in a terrible condition. She her fingers are totally removed off because of the disease. But sorry, I forgot. Sorry, I don't remember her exactly disease. So she her family is totally not getting any government support. Where I think the uh, our prime minister, he already had declared that everyone had to get the ration, but because she doesn't have a ration card, so she's not getting the ration. And when they went for a complaint, uh, uh, the person who is a chairman for the beds, he's not taking any complaint. Instead, he is threatening to that girl that if she go for a further uh, any complaint, then they would do something. They would there's a file on her. So this is what we are getting to see from the field, and it is very terrible and uh, devastated to see such situation when you go to the ground level. And I think in our Kokrajar, because of the model code of conduct is going on, we are totally depend on administrative power. Uh, so uh, even administration is not reaching out. And we went to uh, seek a permission to a circle officer. They are not allowing some of the NGOs to go for a ration relief. So uh, situation where this crisis coming up
About,
is so
2 minutes
worsening.
left.
So uh, these are the points where I really wanted to point out from our area, where I think I know everywhere same situation is going on. Uh, so I think uh, we can only rely on the government. And since in our area we don't have uh, our own government, our government has just dissolved as a couple days ago. So we have to uh, rely on our administration. So that's the main thing where food and the health is where I can see the most terrible thing going on, where we are going to reaching out to people, uh, but we cannot help. We are so helpless to reach out those people, because we have to get a permission from our administration also, and we are not getting any permission for them. So this is, I think, this is all I can uh, share for the ground from the ground level. Thank you.
Thank you very much, Bhaotina. We will now take some questions. This first question is for Nidhi. So I'm just going to read it out here. There's clearly a gulf of difference between the challenges faced by the well-off, say the middle class, and those who are financially much worse off in this crisis. What are the additional layers of challenge for disabled people who are financially poor off? What happens to people with disabilities who are homeless, for instance, as are present in large numbers in all society, in all cities? Does Rising Flame work much with the very financially weak sector of the population too? And if yes, what are the relief measures they have been able to put into effect?
Hi, thank you so much for that question. So, do you want me to go now, or do you want to collect some?
Yes, please. Yes, please.
Okay. So, thank you for raising that, as all of us have been mentioning that being financially well off, and we know this in general and not around disability, just that it is a very big privilege, and it is a space which comes with a lot of what do you say? a lot of benefits, etc., right? And the barriers become lesser and fewer. Um, and so the first part of the question around homeless people, Shampa, they has already answered. So I'm not going to repeat that. There are a lot of challenges that are ongoing, but around what are the exact differences, it is the difference between those sitting comfortably in a house and uh, not having a home to stay, right? Or not having access at all. So if you are in a space where you don't have digital access, you really do not have accessible information. So for a lot of disabled people, it will start from the challenge of we don't know what's happening and nobody bothers to tell, right? While a disabled person who can afford a computer, a smartphone, even a basic smartphone, may receive some of the accessible information. People who do not have disability certification, right? Many individuals do not have disability certification, are not able to access the disability pension. And this, I don't remember the percentage of certification off the top of my head, but it's considerably low. And that's something that we've been all fighting for as a sector, because certification is a huge challenge. If you have certain conditions, certificates are not given, assessments are not done, it's done through a very medical lens and not a functional lens, etc., etc. If you have something like a multiple sclerosis, which is a fluid condition, then you have to go revising certificates because the benefits depend on what is the percentage of your disability, etc. So even that, just not having the certification does not give you uh, give you sort of the disability pension or the access to that, right? Now, many of the disabled people, what Rising Flame has been doing is that they have been supporting other organizations. So, for example, persons with disabilities and migrant laborers who were stuck in Karnataka and were originally from Maharashtra, we facilitated some communication assistance to them, we facilitated some funding assistance to them. We're also now raising funds for families of extremely poor, marginalized, and disabled folks stuck in Varanasi through one of our partners, because we had launched the Rural Leadership Program in partnership with one of the local grassroots organizations in Uttar Pradesh, who work across villages. And our program also ran across 12 villages, which is essentially now come to a standstill because we cannot reach the fields. The field workers may not be able to reach all the fields and all the persons with disabilities. So we're also mobilizing funds to support the people in interiors, etc., to get things moving. I hope that answers at least a part of your question. I'm happy to take more offline. We've also
Thank you.
been sort of mobilizing pieces for blind hawkers, which is a large community around in New Bombay, Navi Mumbai.
Okay, thank you so much, Nidhi. We have a question for Shampa, and maybe this is something that other people can also come in on, but this one is addressed to Shampa. It says, could you address how NPR might impact disabled people in the country in the light of the fact that the census will happen soon? We have witnessed and participated in protests against the CAA, NRC, and NPR, but with this pandemic, that protest has somehow diffused. But even these protests did not have enough voices from disability movement.
Just a bit slower, please.
Oh, okay, so sorry. Um, Basically, they're asking how the NPR will impact disabled people in the country.
Thanks for this question. I really don't think that the effect will be very different from general public. One thing we need to understand is disabled people have been excluded from major any policy level decision, any kind of uh, planning system in our country for very long. And suddenly you are saying that there will be a national population register, there is some kind of counting going on. And we have seen even during census counting, when people came to find out that how many members do you have in your family, the families, because they're ashamed to talk about a disabled person, they actually hidden the fact that there is another person in your family. So this kind of things have already happened in our country, and these are the experiences we have gone through. So now with this new kind of registration and how, like, it's actually very difficult to say that there will be no impact. We don't know what kind of disabled people, whether the counting, how these things will be happening. There is no transparency actually. That is a major issue about NPR. We don't know what kind of questions are getting asked, what kind of, when it starts. Of course now it's being stopped right now. And it is true that it's not that many disability groups joined anti-CA and anti-NPR protest, but for us, we did, at least from our network, NPRD, and in Kolkata, we remember very well that particularly on 26th of January, we did read out the pledge for our constitution, because we felt we are part of this country and you cannot just say that we are not citizens. So this is something which we did here. And I'm sure also aware that it's not done by as many disability rights group as we expected. Also, we need to remember that majority of the disability groups are also registered as NGOs. And you have when you have a registration as an NGO, there is also some kind of, it's not only registration as an NGO. If you want to work for disability groups, they say that you have to get registered under Rights of Persons with Disabilities Act. If you don't have a registration, you cannot work, you cannot run a school, you cannot do a vocational training center. In fact, the Disability Commissioner of Bengal told me just after the lockdown was announced that if there is, if you are not registered under RPD, you cannot do relief work for disabled people. I said, now come on, I mean, there are individuals who are coming and giving relief. I mean, you cannot say that you are not registered. So the organizations are also very much depending on the government registration process, all these things. So it's very difficult for them to come out and make a protest and it's more, we focus more on, as I'm talking about generally the disability groups, more focus is on access and things. And the larger issue that actually affects us in the country, the political issues are usually ignored by majority of the disability groups. It's also because we are more oriented, the majority of the disability groups are oriented towards charity and not so much based on rights.
Thank you.
Yeah, I
thank
think,
you, Shampa.
yeah, I think that's, maybe offline we can talk more about how it's going to go on. Yeah.
Okay, thank you, Shampa. I have a question for Bhaotina, which is that you've spoken a little bit about the indifference of the administration. What about the people in the area? Are they being supportive? Are there group doing anything to involve people into your activities?
Yes, thank you for the question. Yes, in the beginning, since I have also mentioned that in Kokrajhar, model code of conduct is going on, so there are not much involved, but those NGOs and then service holder people are coming up to support for the support. In the beginning, when we talked with our DC, with the commissioner, he was told us to register and register, and then we have to go through some registration, and then we can go for a relief work. So we did the same thing, and it was going very perfectly. No option was there, no opposition, nothing was there, but recently, we get to know that circle officer is doing some kind of restriction for going for a relief work. But since But still, as I think even Paji also mentioned about the why we need to register, where individual people are coming and supporting, like they are going and they're helping out those people individually. So and we have in our area we have one forum, like Lower Assam NGO forum. With that, we are now able to support much more people, and we are also able to not only a person with disability, as a general, we are able to reach out. So I think, or anything I need to involve, I think, and to this, I think this is enough.
Yeah,
Yes.
okay. Thank you. Thank you so much. So we have another question for you, Nidhi, which is that it's a question from someone who is with an individual without disability. And they're saying that most of the times when they're trying to talk about spreading awareness, it is seen as a product of sympathy rather than empathy. And they're asking how, at an individual level, they can change that, and how a culture can be embraced among people with and without disabilities without this kind of assumption of sympathy.
Thank you so much for that question. I don't know if this is specific to the pandemic, whoever's asked this question, but in general also, when you're trying to raise awareness, instead of doing it for somebody, if you do it along with someone, there's this whole mantra on which the disability rights movement works: nothing about us without us. Very often, what we start doing is we start communicating for people. We say, oh, nobody listens to them, so let us tell their story. And because we haven't challenged a lot of our ableist lens at many points, it may be internalized ableism, it may be conditioned ableism, it may just come from a space of I want to do good, which is which somehow gets mixed with charity. I'm not saying you're doing any of this because I haven't seen your communication. I don't even know who has asked this question, but I think it's a very simple way of doing nothing about us without us. I think somebody else has also asked around CSO organizing of inclusive citizenship or things like that, and just around or disability friendly something, spaces or some other designs. I feel like working together with disabled people's organizations, with NGOs working on disability rights, will be extremely important. So, for example, in this current pandemic, also, if you're making submissions to the government around what kind of needs or which kind of marginalized groups are being left out, it'll be great not just to look at the submissions some of us have made. So, for example, Rising Flame with a few others made submissions to police and state authorities in Maharashtra to specifically cater to the basic supplies and the access to basic living facilities and essentials for people with disabilities here. We're a part of the larger group, which is being led by Astha in Delhi, to do advocacy with the center around pension, around essentials, around survival, around support, all of that. It might be helpful to read some of these submissions, but also it might be more helpful to include the voices there. So to talk to people with disabilities to try and understand their reality. And that's why if you see the panel also, we set different contexts for you: the larger, the macro, the micro, the policy, the field, all of those. I hope that answers the question.
Thank you so much, Nidhi. That was a really wonderful response. Shampa, we have a couple of questions that I think maybe they can be taken together. One is that what do you think that the importance of mental health care, uh, will that change, the experience of that change post the lockdown? And related to this, somebody is asking about people with invisible disabilities and how they are being facilitated during the pandemic.
Thanks. This is something which is, this question is something really very close to my heart. So I'm a person who have mental health problems, and I know how difficult it is for people like us to find suddenly a situation where you are not like you had no clue that this will affect us at any point of time. So it's a total clueless situation. But in some ways I feel happy also, because mental health is suddenly being discussed a lot. In general, people are talking that mental health is getting affected, uh, and I somehow, there is a small hope. I think being an activist, you always need to hope, even in this kind of terrible situation. I have a hope that a stigma of being mental, having mental health issues may go after this pandemic, because large number of people who never talked about mental health issues, now they are talking about their anxiety, their depression. And I mean, the scariest part is that we don't have enough mental health support. We don't have enough doctors or psychologists. And but from our organization at Sruti, we actually started a service for disabled people, their caregivers. We also had a shocking case in Kolkata, where a father killed his intellectual disabled son because he refused to wear mask and go out. And that also shows how frustrated some of the families are feeling, because they don't know how to explain to their children why it is important to wear a mask. And these kind of materials are not available. Again and again, I'm talking about the responsibility uh, of state, because this is something a state should have been given us, that what kind of materials are required to explain it to an intellectual disabled child or adult, why it is important to wear a mask, why we are changing our routines. All of us, suddenly we have changed our routines, and how it's affecting their mental health. So this murder, after this murder, and he actually went to the police station and said that I've killed my son because he refused to do it. And so we started a service, and we are getting quite a number of calls where people actually are saying that, say, I'm a blind student of a university, of a very renowned university. Sends a message that, but now I feel I'll not be able to complete my study at all, because suddenly there's so much changes. And uh, also this online study, this whole pressure of suddenly to uh, uh, have to like give semester, and all these changes is making so difficult. So these kind of things are also happening. And again, there are some NGOs, uh, urban based NGOs. There's a big divide in urban and rural areas also. There are some urban NGOs who are trying to make up, sending some kind of information to the parents of the children, sending via WhatsApp videos and things like that. Then I again receive information from people, children who are from a little, not even rural, even peri-urban areas. Their whole special education, whatever therapy they were getting, stopped. So children who have ADHD, children who have some kind of at some spectrum of autism, they are finding it very difficult, and the parents don't know how to deal with it, because all of a sudden this therapy and the service stopped, and they do not have smartphones, so you cannot send a WhatsApp video to explain that this is something you can do at home. And so invisible disability is something which we always need to think of. And that's again, if you think of the disability movement also, there's a hierarchy of, I keep on saying that there is a hierarchy. So there again, the people whom you do not feel that you cannot see their disability are usually neglected. And it's also happening during pandemic. That is a very sad reflection of our society. Thanks.
Thank you so much, Shampa. Um, we now have a question for Bhaotina, which is that somebody is asking about how accessible are healthcare facilities. Are healthcare workers being trained to provide services to disabled people? Are they trained to adequately communicate with people? especially people who are living with deafness or who have developmental and intellectual disabilities?
No, here in our Kokrajhar district, we don't have any health. There are not expert in disability, and also when we speak about infrastructure, there is a hardly thing which is accessible in the institution, whatever institution here. Uh, so they are not trained, and also uh, when it comes to uh, verbally, when you are how you have to morally support and emotionally support when people sit in a health center, they are instead uh, demoralized by the health workers. So this is what till now in my experience I have seen in a Kokrajhar, and awareness is very little here for d- related to person with disability. Uh, uh, I hope I have answered the question.
Yes, thank you
Yeah.
so much.
Okay.
We have a couple of general questions, so maybe we can go for them in order again. Um, the first question is about what I think there's a question about sources of data on people who are living with disabilities. And I think we've mentioned, some of the speakers have mentioned the problems with the census and so on. And then there's another general question about how do we reach out to families who are living with disability? What are the realities of people who live in families where it's not I think there's dysfunctional dynamics. So maybe if everyone can go in order and answer these questions.
Hi, sorry, I thought order of questions. Nidhi here. Thank you so much for those questions. They're really important questions. I think data we're undercounted in census, we're invisible in many data sets. So we'll have to see which data, but I'm afraid that even when we go beyond post-COVID and say, oh, how many people were impacted in COVID? What were the inconveniences? What were the issues? Who survived? What were the survival challenges? Again, people with disabilities are going to be considerably invisible. Understand, just from the way things have been going. So I think we've been saying that also data, when you say data, again, to remark that the government has only data at the most of people who have disability certificates or things like that to access at this point. We've also made recommendations to use the election list to reach out to local NGOs and DPOs who have a large constituency of people with disabilities who they work for or with, reach out to special schools, etc. So those are the ways we can also reach out to people with disabilities, but those will also be some of the ways data could be collected or integrated. And again, I would like to say that when we're talking about gender and disability, again, the conversations around domestic violence have started, but we also need to understand that a lot of, like for non-disabled women, a lot of cases will be unreported. For women with disabilities who may need assistance to even connect that phone, who may not be able to speak, who may not have the language or the vocabulary to complain, may not be able to file these complaints. So the invisibility in data in some ways are going to continue unless many of us, not just activists, but as civil society, take some responsibility. I'm just going to answer one more question around the functional and dysfunctional families. And I think it's just the burden of care, which I mentioned, increases a lot on families. And if it's a dysfunctional family, which many a times, we all feel like family is a very hunky-dory unit. And for those who have a good family support, it is always, again, we call it a privilege. But in dysfunctional families, the chances of discrimination, abuse, violence are just, and isolation and further isolation increases many folds. Just to close this, I wanted to answer something that Bhaotina was talking about in access to hospitals. We were, one of my fellow disability rights activists and I were on a call with the joint secretary of our Department of Empowerment of Persons with Disabilities last week. and we were asking about what if a disabled person then gets COVID and is in a quarantine center. What are the kind of support, if at all, is some thought given to that kind of support? If somebody who's known to them wants to still accompany them, provide the kind of care and assistance, what will happen if people who really are support seekers would, or living with high support needs, are quarantined entirely? I'm going to stop here, but around invisible disability, we have many, many more discourses. I think we need to think about disabling chronic illnesses, disability on the spectrum. So really, people living with multiple sclerosis, muscular dystrophy, as well alongside psychosocial disability, intellectual disabilities, etc., the rare conditions, and a lot has been not discussed, but I don't think we have enough time for that. So thank you for raising all the important questions.
Thank you, Nidhi. Shampa, if you could come in.
For this, two questions. One thing is the data. I think data is something which, like I said, the census, we are not happy with the census data because the census people were not even properly trained to ask what kind of questions are. We also have as a society, generally, people also have a tendency to hide disability. But this kind of, I think there should be actually data collected should be in a very small scale, not in a, like, every municipality can have a responsibility in a municipality area. Panchayat can have a responsibility like this. Because they know they have a list of how many families are there, so they can actually take up this kind of this thing, that every family, what are the family member, the whole structure, and then it becomes much more easier. And until and unless you do it in a smaller scale, I don't think in a country like India will ever get any kind of uh, data, particularly the disability data. That is something we need to understand. Like every time we expect a census will happen or a national sample surveys, NSSO will take place, and we'll get the thing, and we still are on, let's say, 2%, less than 2%, or a little more than 2% of Indian population is disabled. That's the government data. We know it's not possible. So that is something we need to do in a smaller scale in different municipalities and different panchayat. If you have that kind of a system done, then anyway the government have that kind of like they know the number and they can actually use that number to even like a COVID-like situation, any kind of disaster that might happen later. That is something very important to understand. When we are talking about families, that is something very interesting, because when you are a feminist and also a disability rights activist, there is family is something like, because traditionally people with disabilities, children with disabilities are usually taken away from the families, and it was like they're usually dumped in residential homes, and this was a situation, and so the disability movement actually demands the right to live with family, and where in the feminist movement we actually challenge the concept of family, and what is family we need to think of. So if I decide today that if I might give an example, during COVID period, only in one of the student of very renowned university of Kolkata, Jadavpur University, she actually moved out of her natal family, not matrimonial family, because she was facing severe domestic violence, and so the vice chancellor and the dean and the authorities of the university actually took up the issue, and they made the guest house of the, she's not a hostelier, so made the guest house, made her so that she can stay now, because now at this moment you cannot get a PG, any kind of accommodation right now. So suddenly if a disabled person also decide to do that, that I don't, I'm facing difficulties in my uh, own family, in my natal family or matrimonial family, wherever, will she have the access to go and live somewhere else? Because these places are not accessible also. and you might need a caregiver for some kind of support, even if you are living alone, and that is something a major issue also. So if you want to leave your family, how and where you can live, where you can this thing. Since Nidhi raised the issue of domestic violence, I'll also like to talk a little bit about a lot of sexual violence also happening, even though we are not talking about it right now. But we came to know of a case where a blind woman, quite she was in her 50s, she was raped, and because for the lockdown, her husband was somewhere else, he got stuck somewhere, and she was raped in her home. And it's very uh, interesting because this is the first time I saw. I mean, there are many cases of sexual violence happening in the. I mean, throughout the year it's happening. I saw at least NCW send a formal tweet. They tweeted that we are taking this case very seriously because it happened during a lockdown. And I also read a report that the police found who the culprit is. And this is something very rare. We do not see cases of sexual violence on women with disabilities getting even any attention either by police or the National Commission for Women, because this is something it is not accounted for in generally. So I think we need to talk about family, we need to talk about violence and what is the structure of family. If I choose to not to live in my family, which is where I have been born, if I think someone else is my family. So these are the things, issues we need to talk about. May not be always in the context of COVID, but also in the context of COVID, because we are being like forced to live with our families. We are forced to live in our homes, and we don't have much more option now. So that is something also we need to think of the structure, how we can, what we can consider home, whether if it's a home is unhappy, whether still it is a home, and or if I want to leave my family and stay somewhere else, will that be accepted by the government as something which is uh, what we are saying essential service? Yeah, that is one of the important thing I wanted to say.
Okay,
Thanks.
thank you. Thank you so much, Shampa. Bhaotina?
Um, yes. So I am agree with what the panelists, that we don't have a fact data, uh, a data which is not completely we can rely on. But I'll just try to explain it with an example. So we have since we have an association, Women with Disability Association in our organization. So there are some of the women which with our support got disability certificate, but they haven't got the pension. So when we went to the department to ask why these people are not getting, so they said they have a target to give this much amount of people to give pension. So when we raised this question, and they said we don't have data, we don't have that much, we don't have beyond that capacity to give the pension. So there we come to know that in data census, those person with disability are not included, are excluded, and cannot totally. I think I would like to say that some of the parents, they are a little bit reluctant to expose their child, to accept their child at that earliest disability, and they census got that information that when the census comes, it doesn't say about the disabled child because they are not accepting their child. So this is what we get to know. So we cannot totally blame to government department also. I think the awareness level of the parents of accepting their child is also one thing which I think we have to work for. And also uh, as much of a data where how we reach out to families. I think broadly where our what Nidhi and Sampaji have told about how we can reach out and how the sources can be get it. So I also want, I get to see that ASHA workers and Anganwadi workers, they go in the ground level, like in a cluster level, they go house to house to uh, for a health worker and to helping out children. So I think we can easily get from uh, those person, we can get them to work for a getting a census, getting a data of person with disability, because they are the most likely to get access with those families. Uh, this is what I would like to mention from my side. Thank you.
Okay. Thank you so much to all three speakers, Nidhi, Shampa, and Bhaotina, and to our two wonderful interpreters, Manisha and Preeti. Um, this concludes our current series of conversations, A Crisis of Care, Feminist Perspectives on the COVID-19 Pandemic and the Lockdown in India. If you wish to watch our previous sessions, you can go to our YouTube page. I'm sorry if we couldn't come to your question, but they will all be downloaded. And if there are any pending questions, we can send them on. And if they can take them up, I hope that the speakers will be able to help you out. If you want to come to future online events, please do follow us on social media, on Twitter, Facebook, and on Instagram. But for now, have a good weekend and goodbye, everyone. Thank you.